In preparation for the patient registration process and the navigated procedure, it is important that the patient, as well as navigation components, are positioned correctly to enable optimal performance of the navigation system. In this first example, the Fiagon Universal Office headrest is used, which integrates the field generator into the headrest. The patient should be positioned so that the patient's head is centered against the headrest throughout the procedure. It is recommended to use an alcohol prep pad to first wipe the area where the localizer is to be placed in order to ensure a secure adhesion to the patient's skin. Once the patient is in place, attach the patient localizer and corresponding adhesive pad to a stable location on the patient's forehead where the localizer will remain center of the field generator. An example of this would be if the surgeon turns the head to the right during a surgery. Make sure the localizer is placed on the left side of the patient's forehead to keep the localizer center in relation to the field generator. If placement of the localizer to the patient's forehead is not possible, the localizer can also be placed at another nearby landmark, such as the temple. Ensure the patient's head will be centered on the headrest throughout the procedure. Rotation of the head is okay, so long as the patient's head stays centered. Pay close attention that the patient's head does not move outside of the limits of the electromagnetic field, as this could result in the reduction or even temporary loss of the signal being communicated with the navigation system. If the navigation signal is lost during the procedure due to the position of the patient's head, bring the patient's head back into the center of the headrest to reobtain the navigation signal. In this second example, the field generator is attached to a flex arm, which is aligned in what is known as the baseball cap position. When positioning the field generator, it is important that the F symbol is faced towards the patient's head, as this is the direction in which the magnetic field is generated. It is important that the patient's head be centered within the magnetic field throughout the procedure. The patient's head should be no further than 1 foot or 30 centimeters away from the field generator.